Welcome, and thank you for joining us for this Open Mic with Mike webinar. Participants are muted with no video during the initial introduction from County Manager Mike Callaghy. After that, we will move on to our Q&A session. If you would like to ask a question, please use the Zoom application to either raise your hand to be unmuted, or you can submit a written question using the Q&A feature that should be on the bottom of your screen. If you have called in via phone only, you can use *9 to raise your hand. With that, I'll turn it over to County Manager Mike Callaghy.
Thanks, Connie, and thanks for really putting this together and organizing this. I really appreciate the opportunity to talk to all of you. It's been a little bit of time since we've had the opportunity to get together. And let me first apologize for the background. It matches my gray suit here, so I'm kind of fading into the woodwork here, but we will get through this. And I really appreciate the comments that Connie made there, especially the part of the interaction that I'd hoped that we would have here today. You know, I haven't had an opportunity to see many of you in a long time. I'd love to actually hear from you. I know you can put stuff in the chat, and if you're shy, please do that, but please feel free to participate in raising your hand, and we'll call on you. And I'd just love to have that kind of dialogue. I want to hear all the questions you have. This will be the last opportunity I have to speak to you this year, and what a year it has been. And let me just start by saying how proud I am of this organization and the way it has risen up and addressed this pandemic. Again, no playbook, no scorecard to go off, no plan in the past that we can measure ourselves against. This is obviously the first time this has occurred in modern history. And I really do believe we are getting through this successfully because of all of you and all that you have done to contribute and sacrifice through this. I just couldn't be prouder of this organization and what you have done and how we've responded to the public that relies on us so dramatically. So with that being said, again, I hope you participate. I want to make sure I answer all your questions. I got a lot of material to go through here just to update you as to where we're at and what we have gone through. Let me start with the numbers. As many of you know, we are in a surge that is really surging right now. And this is something that, you know, we had planned for, but we hoped that we would never get here. It's something that Dr. Morrow warned us on early on. And it's hard to believe, you know, just a couple of months ago where we were in the orange, we were doing so well, things were opening back up. There was this feeling of normalcy again to some degree, though we knew the disease was out there lingering and certainly invisible to many of us, where we didn't have friends or family members impacted. And I think that it'd be safe to say that every single one of us now knows someone who has been infected or knows someone who has had a family member die from this. And it is that serious. It is something that I have thought I've thought everything about day and night for the last 10 months, as I'm sure many of you have. And before I get into the numbers, let me just go back again and talk about our first responders, our healthcare workers, how proud I am of them. They have been on the front lines now for 10 months battling this unknown enemy, but doing such an incredible job of standing there in the trenches, in service, taking care of those who are scared, who are in need, and doing just a wonderful job, making sure that we had lower rates than anyone else in the Bay Area, not only in the percentage of death, but in cases. And that was because of all the great work that you all were doing in our clinics, in our hospital, in our congregate care facilities for our seniors, getting out in front of it when it wasn't even our responsibility, it's a state responsibility, but you guys have done such a wonderful job. I just so appreciate that for all our first responders, and especially those who are in our healthcare professions. And I mean everyone in those professions who make up our clinics and hospitals. So as the numbers, as you all know, there's been a regional stay-at-home order put in place, which became effective 12/17 at 11:59. And that is because we fell behind the 15% ICU bed capability within this region, within the Bay Area region. Today, it stands at 13.7 ICU beds. But let me put this into context for everybody, just to let you know where we're at today. So our adjusted case rate, and our adjusted case rate is doing so well because of the tremendous testing that we're doing, and I'll talk about that in a minute, stands right now at 17.9% per 100,000. Now contrast that with a month ago, roughly a month ago, November 9th, it was at 2.2 per 100,000. 2.2 to 17.9. The unadjusted case rate is staggering, absolutely staggering. On 11/9, we were at 4.1, humming along in the orange. We are now at 35.9, 35.9. Our positivity rate back in November, November 9th was 1.3, extremely low. Now at 4.8, which just keeps us in the orange tier if we were back in those tier stages. The health equity metric, which really talks about those who are really suffering from poverty and are suffering from the worst cases of COVID, as far as population, are essential services workers in some cases, in restaurants and so on. Back in November, 2.9%, now 8.7% today. Just staggering. So Dr. Morrow believes, and we've had many discussions with him, that things are likely to get worse before they will get better. The new order only applies to essential services to stay open. Everything else has closed, as you all know. We've reduced our retail from 25 to 20%, closed restaurants, outdoor dining, gyms, barbershops, hair salons, and so on. And as a result of this, to ensure the safety of our employees and the public, which is paramount to me, I've asked all department heads to reevaluate their essential staffing needs and to minimize to the greatest extent possible the number of staff working on site. So I've asked them to reevaluate where we're at. Again, it's paramount that we take all necessary steps to protect our employees and the public in a decompressed workspace. So I've asked again to look at and reevaluate the situation in every nook and cranny of this county to make sure that we have only those necessary on site, and we're certainly asking those who can to work remotely, to do meaningful work remotely, which we've transitioned to, and we've been able to do a great deal of our work through innovation and recalibration and technology remotely. But I also understand that many of our employees cannot work remotely because of the essential nature of their job. And those folks we have certainly tried to take care of in these unprecedented times. So all employees who are working remotely should currently remain remote right now for the next 3 weeks. Department heads have been encouraged to develop many different options, including alternative work schedules and/or a combination of telework and office work when necessary. Modified business hours open to the public, including shortening hours of the day or days of the week to reduce office visitors and encourage remote services as much as possible. Flexible work hours for employees to address logistical and social and personal constraints. And I know that this has been a major constraint on families with kids, and I'll talk more about that in a minute. For those who are unable to telework, departments are encouraged to stagger work shifts to reduce the number of employees in the workplace at any one time. I would also remind all of you that this is a great time for everyone to get caught up on mandatory training. What I have absolutely mandated is mask wearing at all times when you're around anyone. I love to walk through the courtyard here and see people sitting at tables together and eating, but not now. And if I do see that, I will ask you guys to separate. And I know that socialization is so important, but those tables are just not big enough. If you're going to eat with somebody and you find it necessary to do that, I would ask you to be at the end of long tables where you can converse, but you are not within that 6-foot distance. This is the time to take all necessary precautions to make sure that we take care of one another and take care of your health, which is, again, very, very important. So we, since since COVID-19, we've had a lot of experience now putting safety measures in from the start. As you remember, we just tried to decompress the workplace and send everybody home that could go home, to try to make sure that we tried to keep it as safe as much as possible. And now we've learned a lot more as to how to try to keep the workplace safe, and institute safety precautions, gather appropriate PPE for all the workspaces and for our employees, and some additional safety measures that have been implemented by the departments include installation of plexiglass. You see now pretty much every department, everywhere you go, has plexiglass in their workstations where necessary and space allowed. Moving of utilize equipment into storage to free up additional space so we can spread employees out further, providing staff members with face masks, face shields, gloves, as well as sanitizing supplies such as hand sanitizer and sanitizing wipes. Creating the service windows and plexiglass cards. I know we're still waiting for a kind of a bank teller window to be put in over here at 455 for billing and planning and revenue services. That is in the works, and that should be implemented shortly. In fact, I forgot to get a time frame on that before I came on here today, but I know that will be coming shortly. And those are some of those service windows that we've created, and with plexiglass. In this case, will be a hard barrier in front of those individuals with the public. Instituting appointment systems to assist with managing flow and public info into the office, rolling out health screening prior to starting work, establishing flexible, alternative, and staggered work schedules and hours, just to decompress the workplace. Again, it's so important. Countywide Department Safety Committee is involved in helping to promote awareness about social distancing and signs and symptoms, so that we can get that word out. And I would ask all of you to be part of this effort to make sure that we address this holistically together, and that we are all on the same page and trying to keep each other safe. And that if you see something, you call it out. You go to a supervisor and say, look, I've noticed something here that's a flaw. We need to take action to correct it, and then leave it up to that supervisor or manager to take corrective action if it's warranted. The detailed list of COVID-19 safety procedures can also be found in the Workplace Readiness Guide on the county SharePoint link. So it's a link to the Workplace Readiness Safety Plan. So all this is online for all of you to take advantage of. Let's talk a little about employee testing. I wanted a place here on campus where most employees are and at Health, so that employees can get on-demand testing. And we've created that, again, thanks to our staff. We have that out there. It's very simple. It's through Curative. Once you're in the system, at least I've worked it this way. I don't know if others have worked it this way. I try to get tested every 2 weeks, just because I think it's good to know. And I think it helps us all with our surveillance. I would encourage all of you to do it, but it's voluntary. You do it if you want to. But this service is available to all of you. All of us have insurance. It's paid for through the insurance. And for some reason, if they don't pay it, the county will pay it. So, but they should pay it because all of you are here now are essential workers, and they're mandated to pay for essential workers. So just an update, Tuesday, December 22nd, it'll be open from 11 a.m. to 2 p.m. here at Redwood City. And then on Tuesday, the 29th, and Wednesday, December 30th, from 11 a.m. to 5 p.m. Now, the Redwood City campus, I've also opened up to Redwood City, our neighboring, for their employees. I don't know if they've availed themselves of that or not, but we have capacity. So what I have done in the past, I signed up the first time, and then I just walk up and show my ID and say I'm in the system. And within minutes, it's a very non-intrusive, self-administered test where it's a swab in your mouth, and you should get test results within 48 hours. Mine, unfortunately, I had to quarantine for last week because of a potential exposure. It turned out to not be an exposure, but I didn't want to take a chance, and I didn't want to come in and infect people. I'm asking all of you to do the same thing. So I had to wait a little bit longer to get my test results back. I think that was an anomaly, but there's a tremendous amount of testing going on, and I'll talk about that in a minute. But please avail yourself of this service. It is free if you desire. There's no waiting in line, no waiting at the event center, but those are still available, or through your primary care physician. Certainly that's available to you also, but please take no chances with this. And then at San Mateo County at the Health Center on Tuesday, December 22nd from 8:30 to 2 p.m. and Tuesday, December 29th and Wednesday, December 30th from 8:30 to 4:30. You can see that. They will be closed on December 23rd and December 24th and Thursday, December 31st. Again, this is voluntary, and I would ask you, if you're so inclined, to get tested every 2 weeks. That is what I am doing. There's a lot of information on that. If you go to for the Redwood City Government Center, it's the test.curative.com walk-up. San Mateo County, it's pretty much the same thing. All that information is online, so you can really get more information. And if you have a need for other services, please go to our wellness at smc.org. Additional employee support. And I think this is critical. And this is, again, the Board of Supervisors taking the lead on this, not waiting for the federal government to jump in because of some of the chaos going on back there. But the existing federal sick leave hours and expanded FMLA are set to expire on December 31st. And I just really want to congratulate Rocio and HR for stepping up and preparing this and bringing it to my attention. And I'll be bringing it to the board on January 5th, extending these leaves through February. So through February, and at which time we will take a look at it while we monitor federal legislation. And hopefully the feds do the right thing and extend this through the rest of the pandemic like they should have a while back. But since they are not, we are. And so as an employee, you currently have access to Family First Coronavirus Response Act, COVID-19 emergency sick leave, which provides 80 hours to employees who need to stay at home due to specified reasons related to COVID-19. And I approve those. I've approved numerous that have come across my desk. And then expanded family medical leave available to employees needing additional time off to accommodate school, childcare closures, or distance learning resulting from COVID-19. So all those are expected to continue as we bring that to the board on January 5th. It is on the consent calendar. Support for working parents, and this is so critical, and certainly we're experiencing this in our office here with some of the executive team who have small kids. And listen, I hand it to all of you. I'm not sure if I could have gone through this with small kids, having 4 kids so close that I had. It's bad enough having them as, in college, using the internet in the house and trying to get their studying done and finals and through all those type of things. But with little kids, especially those who are in kindergarten, first grade, second grade, third grade, I mean, my hat's off to you. Trying to manage this, the jobs that you do while trying to manage your family is unbelievable. And we have said from the beginning that we are here to support you through that, because we know the stress that can be involved in that. We know the toll that it takes on your family. So we've asked, again, for flexible work schedules through the departments, teleworking, use your Family First Coronavirus Response Act, 80 hours of emergency sick leave, apply for expanded Family Medical Leave Act, where you can receive up to 12 weeks or 480 hours to use for childcare. Apply for voluntary time off if you're so inclined. HR has parent child care resources that can be found on the county's Employee Resources COVID-19 SharePoint website. They can include child care after school program options. Again, daycare is such an important part of trying to get families back to work. And what a difficult proposition that has been. And the board has funded now 2 rounds of child care in this county to ensure that parents have that option. There's also a site for how to find child care support through Employee Assistance Program and parenting resources and tools, including webinars, videos, and articles. So we are there to support you through this. We understand the stress that you're going through, and we want to be part of the solution. We do not want to add to that stress. And quite frankly, and you heard this from me, it's family first. It's family first. We will get through this together only if we take care of each other. And it starts with you taking care of your family. additional resources for employees, and I encourage all of you to really go to that SharePoint website for COVID-19. Look at telework resources, benefits and leaves information, COVID reporting, EPA services, frequently asked questions, safety protocols for workplace readiness and safety guides, workplace readiness and safety guides with images. There's all kinds of information on there. All right, shifting gears a little bit now. So in the middle of this pandemic, and quite frankly, before this, I was concerned about the wellness of our workforce. I think that if we have a healthy, happy workforce, it really exemplifies itself in the work that we do and the creativity that we bring and the resources that we bring to residents. And, you know, I've been talking about this with Scott Morrill for some time about creating a chief wellness officer position in this county. And during this pandemic, a couple of months ago now, we did hire a chief wellness officer. We are very lucky to get Nicole Weatherkamp, who really was an employee of this county, working in the hospital as a psychiatrist, but really an incredibly inspired individual who really was focused, in her first love was really on the wellness of employees. So we've shifted gears from her previous job, and she is really focused now on employee health and engaging our employees to make sure that we have a healthy, not only physical, but that mental health that is so important to our employees. And I got to tell you, and let me just start by acknowledging what we're all going through here. This is in time of anxiety, of fear, of could be, some of you are experiencing depression or a feeling like this will never end. And I want to acknowledge that those are all normal feelings as we go through this. And I got to tell you that, there is no, like I said before, there is no playbook. And this is, I've had that feeling many times, quite frankly, like, when will this end? I am so tired of this. I'm so tired of the twists and turns. We get better, we fall back, we get better, we fall back. But we are getting there. And this is a process, and we're getting through that process. So I want to acknowledge your feelings, and it's okay to have those feelings. And we got to understand that that is part of this process, and acknowledge that it's okay to have those feelings. But if you leave those feelings unchecked, those bad feelings will turn to bad behavior, and we don't want that. So we want to make sure that that people don't, and we're seeing this not necessarily in the workforce, but throughout the country, people turning to alcohol or drugs or bad behavior to try to relieve some of that anxiety and pain that they're feeling, and fear and uncertainty and all those things that are out there. But we're encouraging you, and I'm encouraging you, and I'm asking you to ask for help as we go through this. Everyone can avail themselves of EAP. You've got 5 free confidential calls to talk to a professional. These are sessions with those professionals. They may be online virtual sessions right now, but you have the ability to do that. Or you can go to your primary care physician and get the counseling and therapy that you need. And we know that the rate of anxiety and depression is increased 2 to 3-fold because of this pandemic and what we're experiencing here. And there's there's a stigma attached to this that we want to get rid of and say that this is normal in this, that what you're experiencing and what you're feeling is normal. So we want to make sure that you get the opportunities. But remember, you got to be selfish during this time a little bit and take care of yourself. And I found myself apologizing the other day to Nicole. We had a conference call, and at lunch I went out for a run, and I was a couple minutes late, and I was apologizing. Hey, Nicole, I'm a couple minutes late. Sorry. And she was saying, "Are you kidding? This is exactly what we want." And that's how I try to deal with the anxiety and that I may be experiencing, is I try to exercise, and I try to keep those routines in place, and try to understand that things will get back to a sense of normal in the future, and we're getting there, and we're more than through this. We can see the light at the end of the tunnel. We're not halfway through it. We are closer to the end than anywhere else. in any time that we've ever seen this so far. So I want to acknowledge that. I want to encourage you to do the things that make you feel better. Spend time with family. Don't be afraid to call EAP. Make sure you get the help that you need. Contact your wellness champion if that's what will help you. We also have the emotional support chat box up, and that's been I think a great addition to this. So you can really just go on there 24/7. It's available to you. It's Tess, and you can get there at the SharePoint site, or you can contact Tess at 650-825-9634. Enter Claremont in your company name, and you can get started there. And we'll try to get that information out to everyone. But folks, we're almost there, and it's because of your hard work. And it's exciting to see us come out of this. And after what we've gone through, and we're going to come out stronger because of this, because of the way we pulled together. Listen, we've had the EOC open for 10 months now. Having gone through that, I know we have been tested at every single level with civil unrest, with the fires, and with the 10-month stay of this pandemic. We are ready for just about anything that can be thrown at us. We have tested our systems. People have risen to the occasion, and that is the good side of this. The vaccine is here, and that helps me sleep easier at night, knowing that those on the front line, those medical personnel who have put their lives on the line to help others, are the first in this county to be vaccinated and getting that protection necessary to do their jobs and not worry about getting sick because of it. And I can't tell you that has not come soon enough. This is good news for all of us as we start to see the rollout of this vaccine. It's only going to get wider spread as more companies come on board, and we have 2 now approved. That means double the doses. I'm sure we'll have more come on in the near future, and we'll see those triple, quadruple after that. And get more and more available for all of us to get. But I just ask you to be patient, wait for your time, and then if you're so inclined, please get vaccinated. I know I will when my time comes, but county managers go last, I hear, right, Connie? No, I think that's how it works. But nonetheless, please, when you get that opportunity, avail yourselves of it. Let's talk a little bit about the county budget now, because I know that that's so important and probably on the mind of many of you. The CARES Act, county fund investment in employees. We are very fortunate to receive $143 million in CARES funding, but we had to use that, spread that out over a wide variety of things. And the board had to make some very, very difficult decisions on how to spend that money. So let's talk a little about some of the things we have done. We've added 43 additional personnel to the county health staff. That's a $2 million investment to bolster our team's numbers and fight the virus. These positions include swabbers, epidemiologists, contact tracers, medical office specialists, physician assistants, administrative managers. And today, I don't know if you've heard it, we announced that we have made a $4.5 million investment in bringing 40 additional personnel to this county from AMI, a contract with AMI, to staff 10 additional ICU beds. Hopefully, and these will be regional beds, that will be open to the region, because we are all in this together. But hopefully this will bring some much needed relief. This is in partnership with Dignity Health, and give us some much needed relief in this region. I think we're probably the first in the state to do this, to add beds in this way, it's expensive. It's for 30 days. At that point in time, we'll reevaluate and see what our needs are after that. But it'll give hopefully our staff some relief. It'll give this county, this region, some relief for additional beds until we turn that corner and are able to see a decline in the ICU beds that we know is on the horizon. But we only get there, and again, I don't want to lecture all of you, because I've been telling the elected officials this for months, and to go out in the community and spread this, and it's a message Michelle has been spreading. It only happens if we don't see another wave on top of the wave we're seeing right now. If we don't see another surge after this holiday season that we're seeing right now after Thanksgiving. And we can certainly look to Thanksgiving, we can look to Halloween, and we can see the surge starting after those opportunities for people to get together. And it's tough not visiting with family or friends, but I'm asking you this holiday, please, please do not do that. Do not get together in large groups and congregate. Please make this a different holiday season, and let's get through this safe. So as I mentioned before, the county has implemented both the federal and local leave programs. So the COVID emergency sick leave up to 80 additional hours, but that has come at a cost. And these are investments that we're making. So all employees are provided with these hours, and so far we spent $5 million on that. Additional $23 million is expected to be spent on these additional 80 hours that we put out there. Expanded Family and Medical Leave Act, we've spent so far, and these provide for additional 400 hours. So far, we spent an additional $1.7 million on that. The Essential Worker Leave Program between April and May, where we gave people 40 hours pay period for those that were here, that came to approximately $40 million, additional $40 million in benefits for employees. 10 million has been used so far, and we got another 30 million that we expect to be used. The staff safety, the testing, we've invested 3.5 million in this testing for our employees. The workplace safety investment, almost over $250,000 in plexiglass and sanitation stations and different things. And PPE, we invested $18 million, and a shout out to Scott Johnson and his team for securing that PPE. And imagine being in competition with the entire world, seeking the same type of materials. And we were able to pull that together. So now we have that stockpile to take care of those who work in healthcare. To those who work are still here, we have the PPE for our essential services workers here. In our home technology investments, the county's invested $9 million in tools and resources, laptops, servers, software, to allow employees an opportunity to work from home and to recreate the way we do business. That is incredible. And I just also want to give another shout out to John Walton and ISD. Not only did they staff up really quick and get all that, push all that technology out there, but they're also in the midst of one of the largest lifts in the county history in bridging that digital divide for kids who do not have the ability to work remotely from home and participate in school. The Board of Supervisors have allocated millions of dollars to allow John Walton and his team. And again, we're not the school district, we're not the superintendency of schools, but we are stepping in and helping the superintendency of schools to bridge that digital divide and making sure that kids have access to the internet so they can learn and not fall behind. And it's just an incredible heavy lift. John Walton and his team are doing an incredible job. So I could go on and on about the money we've invested, but I can tell you to date, we've invested over $100 million, $100 million in combined FEMA and CARES money and county general fund revenues to our employees using all available resources that we could. And this has been made possible by the stewardship of the departments and this Board of Supervisors, the way that we've been fiscally responsible over the years. We knew that there would be a rainy day coming, but we didn't know it'd be in this form, certainly. And no one could have predicted it would be in this form and all that has really meant for us. Additionally, you know, we've got another $900 billion that the federal government has indicated that they are putting forth right now. Unfortunately, none of that is slated to come to local government or state government. And that, unfortunately, is very bad news for us in the cities, because we were hoping to get more money to help us get through this, you know, in the area of you know, there will be money going to struggling families and businesses and vaccines and tests and testing and tracing, which is all good information and good things to get out there, and rental assistance. All those things are in this $900 billion stimulus deal, $600 going out to families, to individuals and families. All that is is really good, but no money coming to the county. So the county income, let's talk a little bit about this, Connie, if you can bring some of these slides up. And let me just show you where we're at with Measure K and the money we've lost in Measure K as a result of loss of sales tax. You can see where we were from 18, 19, were the good years. And then from 19, 20, we lost about $4 million. From 20 to 21 projected, we will lose about $15 million in the loss of sales tax. And why is this? What is driving this? The number one area in the county that we generate sales tax is at the airport. I don't know if you've been to an airport lately, but it is a ghost town. Of the 100,000 passengers, for example, that used to come through SFO, there's about 3,000 a day now, according to Ivar, the CEO there. So 3,000 to 4,000, maybe 5,000 on a busy day. That is a dramatic drop in sales tax revenue. But again, we were waiting for this, and we'll be able to sustain that because of the rainy day funds we had put in place and the understanding that that day would come when we'd have to use it. Let's go to the next one, and let's talk a little bit about sales and use tax revenue. We can see this has dropped off dramatically also, as you can see here, with a $11 million reduction in non-department sales and use tax revenue. Quite dramatic. Let's go to the next one. The TO2, this is only the good news that we have. Certainly it's nowhere near where it was in the past, but we're actually going to see a positive on this. You might ask, well, why is that? Because all these hotels are closed. But the Hyatt Regency opened just before the pandemic and was generating great revenue for us. I mean, just terrific revenue, higher than projected. That has come down, but we're still seeing some bookings there. The next one is a staggering one for me, and that is a vehicle rental. There is literally no vehicle rental going on in the county. We're projected to, last year we lost about 823,000. This year we're projected to lose about $16 million. Now, on the good side of things, I was able to go into the departments and we wanted to thread a needle here in making sure that we tried to get through this without layoffs, without mass layoffs. And so far, we've been able to do that through this budget cycle, through 2021. Remember, health had a significant budget deficit going into this. I think it was $57 million before we started the pandemic. They have taken steps to try to correct that in a combination of reduction of programs, and elimination of some positions, or where they've actually found, I think, positions for most of those people, or through retirements or attrition or whatever it may be, but also through not only revenue generating programs, but also through reduction of programs. So I've asked each department to take permanent reductions. Those reductions have resulted in $16.9 million in savings that will get us through this time without hopefully mass layoffs. I don't know where we'll be tomorrow or how the economy will respond in the future, in the next year, as we start to prepare our 2-year budget. We'll have a better indication as we get further into the year, of course, and see how the economy responds to the vaccinations, and if we're going to bounce back, or if a lot of these businesses continue to go under. My bet is we do bounce back, and we bounce back strong. And I think that if any county is positioned to bounce back quicker than anywhere else in the country, it's this county. With the thriving economy that we had before, with the airport generating sales tax, I think people will be starving for travel after this. Whether the business travel responds like it used to, or whether we're in a virtual world for business, will remain to be seen. We still have strong property tax, and that's what really I watch for the impact on the general fund dollars. We hope that continues, that people still desire to live here. So far through the pandemic, we have seen strong real estate markets continue with a reduction in rental markets a little bit, but that's not a bad thing either, because we want people to be able to live here. That's a good thing on the rental side. I also had removed $5 million from the probation budget, and thank you for, John Keene to working with me on that, because we saw such a reduction in the kids being incarcerated at YSC over time, not only because of the pandemic, but over time we saw that. So that reduction was in the works prior to the pandemic, but all departments, with the exception of health, have taken an additional ongoing cut, and the departments are going to try to weather this. We put together a strategy so they do not have to lay off people to the extent they had built up their reserves in a way that would allow them to get through this ongoing. And they may have to cut positions because of attrition later on, but my primary focus is on maintaining jobs, especially in the middle of a pandemic. The board has supported this generously, and that's something that we continue to focus on. So let me just, and I know I'm going to miss people as I go through this, but let me just say how proud I am of the executives that I work with every single day. And, Ileana, from the beginning of this, Ileana Rodriguez, the deputy county manager, I put in charge of the EOC, and she has done an incredible job. We have just now transitioned in the middle of this. The sheriff and I worked together to transition OES into a situation where Dan Belleville, who was the communications director, will now oversee OES with a tremendous background in fire and EOC operations, and his desire to serve the community. So he is now the new manager there, and doing a great job. And Ileana is back to doing overseeing operations and back here, but has worked on every facet of this and done a great job. Peggy Jensen has done an incredible job running so many different programs on the day-to-day basis. I can't even begin to tell you the hours, the weekends, the nights that these folks have put in, and it's just all in service. And in the newcomer to our team, Justin Made says, I made him the testing czar, and he has moved us from really just the basic testing to number 2 in the entire state in testing per capita per 100,000. We're at 961 tests. If you had told me that, I'd said at one point in time that we'd be the second highest in the state in testing per 100,000, I would have said there's absolutely no way we could do it. But Justin has worked with health and all our folks and really done a great job. And Robert Mankia, I can't say enough great things about how he has managed the budget through this is phenomenal. I don't think there's any finer in the business or chief financial officer. I think he is unbelievable in the daily briefings he gives me, and the way he keeps me up to date, and his creative way of looking at the budget is just amazing. And certainly Connie, who has really helped me every single day to make sure that we keep the elected officials in this county updated, has been nothing short of tremendous. Was daily briefings turned to weekly briefings, and now, thank goodness, every other week briefing, because the amount of work that went into that. But it has really helped to consolidate the county as one voice, all of us moving in the same direction. And Michelle Duran, I can't say enough great things about on her team on the front, the PIO front, and keeping informed everyone, which is such a critical role in these type of situations. She has done such a tremendous job. And let me go back to the budget and talk a little bit also about Kim On Lee, who has done such an incredible job. We were first. We were one of the first in line for FEMA reimbursement. And I can't tell you how critical that was for us to be there. And Kim did a great job with Robert getting us there in that place in line, because that allowed us some early reimbursement. And now they've stopped that. So if you weren't first in line, we were, I think, 7th in the country in line for FEMA reimbursement. They have reimbursed us a great deal amount. Now they're requiring everyone to use their CARES and everything else before they're reimbursed. I don't even know if there'll be enough money to reimburse everybody at the end of the day, but we were one of the first, and we received a lot of that reimbursement up front. Dr. Scott Morrow, one of the hardest jobs in the country, is the health officer, and he has done an incredible job making very, very difficult decisions. And what he did, unlike anyone else that I know of, or any other my colleagues in any other county, he did it in collaboration with a subcommittee of Supervisor Pine and Supervisor Groom and the Chief of Health and John Byers and myself, where we would talk every Tuesday, and at the beginning it was every single day, about the next steps and what we would do and the hard decisions he had to make. And the latest one, staying open while everyone else around us closed. And I supported that because of the lack of evidence that showed that that was where COVID was spreading, and the detrimental effect, the devastating effect it'll have on businesses that we're experiencing now. And a lot of new information is coming out around some of those closures now. Certainly the Chief of Health, Louise Rogers, and her staff, the incredible response that they have really made to this effort here has just been unbelievable throughout this whole pandemic. And when you talk about health, you got to acknowledge many of you, the contact tracers, who have stepped out of your traditional role as an employee in this county. And we've asked you to take on a new role, arguably one of the most critical roles of this entire pandemic as a contact tracer, to allow us to get ahead of this disease. And I honestly believe that that is why we are faring better than other counties right now with the spread of this. They have done such an incredible job. 115 of you, we have reassigned out of your normal positions and put you into this new position. Environmental health has done Heather Forshee and now Wayne Haas with the COVID-19 compliance team have done just an incredible job in really supporting our businesses and keeping them healthy and safe while they're trying to maintain the opening. The public policy and planning team led by Cassius Lockett, I can't say enough great things about. These are the people on the ground on a day-to-day basis. Those are your dashboards. Those are the epidemiologists. Those are all those people tracking the same where resources should go. I don't think Cassius has slept in months, but he just still comes back and does such a great job. The Congregate Care Nursing Facility Support Team, these people honestly save lives. We saw how many people were dying in congregate care. We put a team in there. These are some of the new hires we put in there to really go in and control this. And I know of cases where they literally stopped COVID-19 that was sweeping through not only the patients there, but the staff, and people were walking out and there wasn't enough people to support the organization. They stepped in and kept it running until we were able to take that over. Lisa Mancini and the Great Plates program with Aging Adult Services, unbelievable. And Danielle Lee and Jessica Mulligan, everyone else who's really helped with that program. That is one of the huge, huge success stories of this pandemic, has pumped millions of dollars back into this economy while feeding our hungry. I think they've got 300 people, 3,000 people that feed on a daily basis, 3 square meals a day. And we're supporting those restaurants that are providing those meals and all the employees associated with it. There's a win-win-win for everyone. And it's just been a tremendous effort. Scott Gilman with BHRS and all that comes with it, it's just been amazing. Just a shout out to Ray Hodges and Don Grady for what they did on these hotel closures. We closed 4 properties in a month, unheard of in San Mateo County history, because of guys like Ray Hodges and Don Grady. Don Grady called me on weekends and nights and working till the wee hours in the morning to get this done. It's just unbelievable. And I'm just saying this because I want to give you a little behind the scenes idea of what's going on. The Office of Diversity and Equity that continues to convene important race and COVID-19 town halls throughout this county is amazing. I am hiring a chief equity officer who will take over in 2021 to coordinate equity services throughout this county. This was something that Supervisor Slocum started his year as president on equity. And this is something we're committed to into the future, and making sure that we get that done. The Human Services Agency, I can't say enough great things about Ken Cole and what they've done through this pandemic. They've housed over 1,700 now, 1,780 individuals in the county shelter programs. They have stood up hotel after hotel to accommodate these folks. And Selena Toyley and Jessica Silverberg a tremendous team reaching out and taking care of our homeless, some of our most vulnerable people in this society, and all the work that they've done on these new hotels too, which will get us eventually to functional zero homelessness in this county. If we can't do it, I don't think anyone else can do it. The Office of Sustainability, led by one of our newest directors, Carolyn Blady, has done just, hit the ground running. Can you imagine coming in as a new department head in the middle of a pandemic, not even getting to meet your employees, but she has done just an incredible job with her engagement team, the business engagement team, and the Great Plates, and all that she has done. It is just amazing, the work that they have done. The Office of Community Affairs, Emma Gonzalez and her team are just incredible. Not only have they handled so much outreach and so much frontline work with our CBOs during this pandemic, but they, ladies and gentlemen, made us the #1 county on response in the state during our recent look at our census. #1 in the state on response during a pandemic with all the other outreach that they were doing. It is been just tremendous work with the Mass Mobile and all these new ideas that they've implemented. It's just amazing. The whole CMO health system communications team has just been incredible. And let's take just a moment to just pay. Connie, can you roll this video? I just want to show you the first vaccination in this county of one of our doctors, Dr. Georgie. This is historical.
Good? Okay.
Hang in there. This will be the first step, right?
Okay. Vaccine, okay, this can go for your table. That's 5 doses. Okay, it's mine, 5 doses. No pressure, Sage.
I know, right? Your famous message.
There you go.
Thank you, Mr. I'm very happy that we got the vaccine. We had been waiting it for, well, 1 year. I feel more comfortable taking care of my patients, the job which I love. Thank you.
Joel, you are one of our true.
Okay, and why did I want to show that? Because that is the beginning of the end of this battle against this virus. That shot right there, that vaccination right there represents hope to all of us. Something that we have looked forward to for 10 months and all that has come along with that, all the sacrifices that we have all made. But that is the beginning of the end, ladies and gentlemen. That's why I'll come to you and say that there is hope. It's just around the corner. We're going to start a new year here just very shortly. And we will be there with mass vaccinations before we know it. Just a couple more shout outs to John Byers and County Council. I can't even begin to tell you the amount of work that they have put in. They were hard workers before, but I've asked them to triple the amount of work and all the requests that we've had, all the contracts, all the last minute things all the orders. It's just, it goes on and on and on. And John and his team have stepped up. I always say this, the best law firm in the state of California, hands down. Ana Rocio and her team in HR, what an incredible job that they have done throughout this in trying to get information out and trying to deal with all the things that this pandemic has brought along with it. It's just been a heavy, heavy lift, something that certainly Rocio was not counting on when we started 2020, but has certainly risen to the occasion. John Walton, we talked about, was done an incredible job. Jim Porter in running, coming into the EOC and running operations, for a period of time, and all the help that Public Works has brought along the way is just amazing with setting up these different sites for us that we needed. I mentioned Dan Belleville and Teresa Robbie, all that she has done in the EOC and to help and Donna Valancourt for the volunteer. Came back and helped with the volunteers. Scott Johnson, Kim Kanye, and the sheriff's office, all that Sheriff Carlos Bolanos has done with all his folks in helping at every stage of these crises that we have faced in this year. It has been an unbelievable year. But let me not stop there, because some of the most important people in this county are my bosses, my 5 bosses. Certainly Supervisor Slocum, president of the board for the last couple of days here, has done a tremendous job leading this county as president of the board through the most trying time this county has ever faced in its history. Certainly Supervisor Horsley and Supervisor Groom, Supervisor Pine and Supervisor Canepa, along with Supervisor Slocum, have all stepped up and been tremendous leaders throughout this entire ordeal, never wavering, always with a steady hand, always doing the right thing, always asking the right questions, and always pressing us to come up with better answers. And I've just been so lucky to work with them and to really be with them through this. And why is it so important? Because we've given out over $82 million. And you can see here with this graphic where this money has gone. And the board has so generously made sure that this money is distributed to individual families and grants and small businesses and nonprofits and immigrant assistance programs and child care grants. 24 million to the Great Plates program, 4 million in county funds for nutritional assistance, 300,000 for small residential rental, 1 million for additional support for tenants, 6 million in county funds to provide for access throughout the county to poor internet connectivity. Those are those kids I was talking about earlier. In addition, they've put in place a moratorium on rent increases for a period of time in the early stages, and the countywide moratorium of evictions in the early stages, and the temporary moratoriums for unincorporated areas. And of course, the supplemental paid sick leave we talked about, and the temporary cap on commissions and fees. But it goes on and on and on, and I can spend the next hour talking about all that we've done in the county, but it really comes down to all of you and the work that you have done. The resources have been provided by the board, but you are the ones out there making sure they're getting in the right hands and doing all the things necessary. And I just want to again say thank you for all that you have done, that we are in this together. It has brought us together like I could never imagine it would, but we will be better because of this experience. It's hard to understand that, it's hard to say that, because this is such an incredibly difficult situation that we've been in, that it's impacted all of us, through our loved ones, through the sacrifices that we've had to make, through the things that we've missed in a year of our lives, through the loved ones that we've lost during this last 10 months of our lives. So this is our burden, this generation, the generations that are alive today. This is the burden that people will talk about 100 years from now. And hopefully we will never see this in our lifetime again. But I want you to know we are at the beginning of the end of this. Because of your hard work, because of the way you doubled down and stepped up, people are alive today. People are housed today. People have hope today because of all of you. And my greatest holiday wish to all of you is for peace, for peace of mind to know that we are coming out of this and will come out stronger. It's for your safety and the safety of your loved ones as we battle this to the very end. And again, I'm asking all of you to stay safe as we get through the tail end of this and onto that vaccine. I want to make sure that every one of you who is so inclined has an opportunity to take that vaccine and have that vaccine and have the protection necessary and the peace of mind that comes with that. But I want to also end my portion of this by just saying happy holidays to everyone. I promise you 2021 will be a way, way better year for all of us. We will come out of this. We will be stronger. We will have brighter days ahead. We will do great things because of the lessons that we've learned here. We will be prepared in so many different ways that we couldn't fathom being prepared in before this. And this, again, just underscored the great leaders that we have in this organization, department heads, the managers, the supervisors, but more importantly, all of you employees on the ground who are the essential services workers supplying that critical service to those in need, especially during this time. So happy holidays. Please, now I'm happy to take questions. If you're so inclined, please raise your hand. I'd love to hear from you in person. And if not, if you want to write a comment or a question, I'm here to answer all of your questions and comments to the best of my ability. And I know that Rosia's on too. So with that, Peggy, with that, Connie, please.
Sure. Why don't we start with some of the questions in the Q&A, Mike? The first question is, how are departments implementing telework models, and what businesses or government agency do you see as a model we can follow?
Yeah, I mean, I think that every department has instituted some form of telework or another. Kim and child support, I think their whole department is working remote now. I think that that's created a model that is really one that has worked very well for her. Obviously, it's going to be up to every department, and I've left it up to every department head to look at their organization critically, and to err on the side of caution and remove as many people as possible while we maintain the critical function of government. And so I'm not going to presume to know the ins and outs of every department and the critical needs of every department in the day-to-day operations. And that's why I have department heads who I trust, who I believe in, who I know will do the right thing, and supporting all of you and the families out there during this critical time, especially during this critical time for the next 3 weeks as we go through the worst time in this pandemic. I think that, this certainly creates a model that we will examine further as we move forward in business as we come out of the pandemic. And people say, oh, I can't wait to get back to business as usual. And I say, I don't want to go back to business as usual. I want to make sure that we use this opportunity and the lessons that we learn to advance the way we do business, to provide services in a better format. And I know people like Steve Monowitz in Building and Planning are working on those type of things right now with electronic submittal of plans and using innovation to move forward. That's what I want. I want to make sure that we don't go back to the way we were, that we're more prepared, that we're ready, that we're thinking differently. And we were already starting to think that way before the pandemic and trying to think of ways, can we have people work in remote areas across the bay so they don't have to come across the bridge and deal with that traffic every day? Is there a different way that people can work remotely? And we're seeing, and we've tested that. But there are some great models out there. I think that, certainly unlike Salesforce and maybe Facebook, we do have a need, for essential services that can't be substituted, that hands-on, face-to-face critical need in our first responders and those who work in critical care. Though even, we're seeing more of the teledoc, the virtual doctor in the medical setting. So I think that we've learned a lot of lessons and we'll implement those moving forward. And I look forward to that exciting day of a better tomorrow than we were a year ago.
Next question is there an ICU bed list of which hospitals have ICU beds left for our county?
I'm trying to think if we break them out per, I can't remember, to tell you the truth, if we break them out per hospital or just county-wide. Maybe someone in health can write that into the chat there. I can tell you we're at 13.9, I believe, as a county today. Where those particular hospital beds are, I don't know. And that's including 6 that we have taken from out of county. One of the things that we're worried about is, virtually some areas like the San Joaquin Valley and Los Angeles are, and especially the San Joaquin Valley, I believe, is at 0 capacity. That means they have no beds left. And they're going to go where there are beds. Same thing with Los Angeles. If they run out of beds, they may have to fly people to Northern California. So we're, these hospitals work in concert together. Sarija, and by the way, I just want to also mention the great job Sarija has done in the day-to-day operations. What an incredible partner we have with health because of Sarija, in part, and all the things that she does on a daily basis in interacting with epidemiologists and the press and making sure the dashboards are up and all those things. And Travis and everyone else on that health team. I just can't say enough great things. And I know I'm missing a lot of people.
This is more of a comment, Mike. The county wellness program is offering so many great online programs in response to COVID-19, and I am so proud to be part of it as a wellness champion. It would be fabulous to see you take a Wednesday wellness walk via Zoom in early 2021. If there is time to show how important wellness is to our health, the time is now.
I think you're absolutely right. I couldn't agree more. And I hope, especially now, everyone is getting out and getting exercise and walking away and meditating or whatever it is. You have got to, and I mean, you have got to spend time working on your own wellness. You will not be able to be an effective employee, effective mother, father, parent, or whoever you may be, unless you take care of yourself first. And that's what I'm asking everyone to do. Please take this time, be a little bit selfish and spend some time, carve out some time for yourself. Go for that run, go for that walk, meditate, do yoga, whatever it is that gets you to that place. And what the individual was talking about was right before COVID started, we were going to start Wednesday walks out here in the courtyard where I was going to come out and we were going to do a Wednesday walk, just a 15-minute walk, whoever wanted to be out there, an opportunity to interact with those who you haven't had an opportunity to see in a while, to get some exercise, to focus on wellness, to focus on getting out of the workspace and getting healthy. And I really ask you to all to avail yourself of that opportunity right now. And I will certainly consider that Wednesday walk virtually.
Next comment, Mike, is great idea to have a person dedicated to employee behavioral health and wellness.
Yeah, and let me just say, not a person, but Nicole is passionate about it. We are so lucky to have someone of that caliber with her background who lives and breathes this every single day and comes in with great ideas. And I only look forward to where this will go after this pandemic is over and how we concentrate on that. We keep that in the forefront and making sure that this is a well place to work. We want happy, healthy employees, and it all starts with your wellness, not only your physical, but your mental health wellness.
This is a question for Rocio. Where do we find the information on the testing sites?
Thank you, Connie. So all the information is available on the SharePoint site, and specific to testing sites, you could click on COVID testing. And Wellness also sent out an email to all employees, and that was sent out on November 9th.
And Mike, you've already answered this, but I'm going to go ahead and combine 2 questions here. The first is, will the county extend the COVID-19 sick leave past December 31st? And why do our emergency sick hours expire on the 31st? Why can't we cash them out if we don't use the hours or roll over to 2021?
Rocio, do you want to answer that? Now to answer your first question, we are bringing that to the board. It's on the consent calendar. Obviously, the board has to take action on that, so I'm not going to speak for the board. But they've been a very, very generous board and understand how important these benefits are to employees. That'll be on January 5th. We're bringing that back. The federal government, again, did not act, so we are. So, Rocio, do you want to talk a little bit about that?
Yeah, so that's correct, Mike. So it was the federal government that set the date, the expiration date. And again, the expiration date, the December 31st. And we will be bringing, as Mike mentioned, we'll bring this to the board January 5th, excuse me. So it will be extended, and we'll continue to monitor legislation. And if anything changes, we'll bring it back to the board, hopefully by February 23rd.
Yeah, and we hope the federal government do the right thing and extend this through the rest of this pandemic. With the change in, I have no idea what President-elect Biden will do, but I think that he may be more sympathetic to this plight here.
Next question, Mike, is my wife and I voluntarily had tests with Curative. Both of us got negative results. How often do I need to be tested, though I'm only teleworking and still go out for groceries in the pharmacy at least once a month?
Well, now, and I just want to remind everyone that that test is a point-in-time test. So all it says is when you took that test, you were negative. What other interactions you had beyond that or after that could have exposed you to it. So I think it's really a comfort level for all of you. I can tell you if you're on campus here, you have the ability to test every 2 weeks. I have availed myself of that. I will continue to avail myself of that. And it's really based on your comfort level and your interactions, especially for those essential services workers who are interacting with people on a daily basis. I would highly encourage you, for the safety of your family, to either avail yourself of the opportunities here or go through your primary care physician. If you're sick, do not come to work. If you are sick, again, do not come to work. If you have any of those symptoms, do not come to work. This is a time to make sure that we keep everybody in this workplace healthy and that we don't expose anyone to undue risk.
We have a raised hand, Mike, from Khalil Chopra. I'm going to unmute you and please ask your question.
Well, welcome, and thank you for raising your hand and being the first to stand up and ask a question. I just really appreciate that.
Sure. Hi, I'm Kokil Chopra. I'm one of the Access Team Psychiatrists with BHRS.
Yes.
It's just related to the sick leave again, because with our understanding, both my husband and I work for the county, and we have little kids, 5 and 9. So I just realized a couple of weeks ago that this leave is going to expire. So we started to use this up when we can to help with the kids. Now that if we end up using it, will you also be requesting the board to, when you say extending, do you mean just extending the current, or putting out a request for another bulk of hours for us? Because obviously if we end up using, even if I don't use 80, I'll probably end up using 70 hours. And if this pandemic situation is expected to continue at least for a few months, which it is, I will really appreciate some more hours for childcare.
Sure. Rocio, do you want to address?
Yes, so at this time, we are extending the hours. So we're not adding additional hours. It's extending. But I should note that we're also extending the hours, an additional 80 hours, and that's for individuals that do get sick. And so that will also continue. But again, in response to your question, it's the extension of hours at this time.
But are we not anticipating that a lot of people would have used those hours by end of this month, because of the fact that we all were under the impression that these will expire? Plus, it's not 100% known yet if these will be extended. So we'll end up losing those hours if it doesn't get extended. If it makes sense. I don't know. I mean, I'm just trying to just logically trying to think this through. Like, should I use these hours thinking like, okay, I might not get them, in next year, although I need them. I love to save them ongoing, but.
Yeah, Doctor, I can understand the predicament that you're in, but I can tell you that, again, I don't speak for the board. It is on consent for the 5th. I would think that there's a good opportunity that the board's going to approve this extension.
Okay. Thank you very much.
Thank you. Who else? I'd love to see somebody else come live and ask some questions.
We do have more questions in the chat. Let me ask a chat question and go back to the raised hand, Mike. Are there any plans to issue the COVID-19 vaccine to all county employees, similar to how you deployed the flu shot?
You know, the state has really set up how this vaccine will be distributed. And a lot of that, quite frankly, is still unknown. You know, they've set up tiers, but the rollout is a little bit murky still. And I will keep certainly our employees updated on that rollout plan, and if we ever do get there. But I know that, you know, they're also, you know, I'd love to see that, quite frankly. But given the tiers that we have, I'd love to see it operate like that because it's so convenient. Now, hopefully all of you also got your flu shot, which we had here on campus. And let me just stress again, you need that flu shot because, you know, God forbid, you don't want to get both of these, but that flu shot is available. But I also know that the state's looking at you know, CVS and different pharmacists and businesses that will administer this test, much like it does the flu vaccine. So more to come on that, and we will keep you updated every chance we get to roll out that information to all of you. And again, I hope to the extent that everyone here is comfortable with getting that vaccination, that they will avail themselves of it.
We're going to go to a raised hand now, Mike. Karen Rosenthal, I'm going to unmute you and please ask your question.
Karen, how are you? And thank you for raising your hand.
Hi, good afternoon. Can you hear me?
We can.
Oh, thank you for having this session. I'm sorry if you covered this because I did have to step out to tend to my kids, but I wanted to know if you had an update on COB3 and the parking lot construction.
Yeah, thank you. You know, I didn't talk about construction this time, but I got to tell you that Adam Ely and his staff have been doing such a great job. The parking lot construction is coming along very, very quickly. And I don't want to jinx it, but I don't probably even want to say it, and probably Adam will kill me for saying it, but it looks like they might be ahead of schedule. COB3, we have gone back for a completely new redesign. The design that Studio Gang had for us did not work financially. And I think that the employees who see this new design, you talk about health and wellness and how light and airy this place will be, will love the aesthetics of this new building. We hope to start construction in 2021. We are putting the final touches on the design right now. We hope that in early 21, at some point in time, we can start working on the foundation and at least try to pick up some speed there. But because of the budget constraints where our last design had us, we had to really go back and rethink this and redesign it without losing. In fact, quite frankly, I think we've gained a lot with this new design, and I think it'd be aesthetically pleasing. I can't wait till we get there. I know many people are looking forward to this, and more to come in 2021. But the parking structure is scheduled to be done by June. I'm thinking earlier than that, but that's where we're at.
Thank you very much.
Great. Now we'll go back to the Q&A. Will the county consider early retirement for eligible employees?
No, I don't think we're there yet. My position right now is that we are, you know, because of the prudent actions of the board in the past, in the way that we allowed departments to build up their reserves and now take some of that money back into the general fund, that I am hoping that we can weather this storm without layoffs and without any other actions other than departments managing their budgets. And that may be through attrition in some cases. It may be, you know, through reduced hours and others in overtime and some other things for those departments that get that. So it may be the reduction of programs or whatever it may be. It may be through automation of and making employees' jobs hopefully easier and better service to the public. So I don't expect to do that. And I think that, I hope that we're going to be able to weather this and get through it with the measures that we have taken in this new budget, and we'll look for to maintain that into the next 2-year budget.
Another question, Mike. You covered several points regarding telework. Does the county foresee more flexible teleworking options to advocate for stronger work-life balance after the pandemic is over?
I would hope so, because it doesn't make a whole lot of sense to me for people to sit in 2 hours of traffic, and I don't know if we'll go back to that. In our community here, in our home, it takes away a lot of family time and quality of life time. I don't know what the outcome will be as far as traffic after this, but I will be encouraging, as we were before this, every department to look for opportunities to the extent possible. And we know that that's not always the case. And we know that, we have to, our job is to serve the public to the extent possible that we can do that in a meaningful way and continue to excel at the work we do, or maybe even enhance the work that we do. We would certainly be looking at that and continue to look at that. And I think that we've got a lot of lessons to reflect back on how we can do it in an effective, efficient way, and what jobs can be continue. And maybe it's just a couple of days a week, and maybe it's in a couple of days a week, and where you have your group, because there's something to be said for the dynamics certainly of a group getting together and interacting, and that teamwork that you experience when you're on campus. And the creative, and the creativity that's brought with all of that, with people sitting in the same room. And I don't know about all of you, but I mean, I get Zoom fatigue. I'm on virtually all day long, and I think it's in some cases more difficult than in public. But I certainly understand that commute, and we have no way of telling what that commute will resume to. I hope it doesn't. But I also am concerned about the environment, and what can we do to make sure that our employees stay off the road and continue to work. It will be a focus in 2021 and beyond as we, look for long-term. And that's, Carolyn Blady from OS has given out grants, $600,000 grant money to departments to explore different ways to work remotely. And we will continue in that in the new year.
Here's a question for HR, Mike. If we have over 350 hours of regular sick time, is it possible to donate our additional 80 hours of emergency sick time to someone who may have run out of sick time and who may need it?
So we do have a catastrophic leave program. So yes, employees can donate sick leave as well as vacation hours for folks that are ill, including those that have COVID. However, you cannot donate the additional 80 hours, the COVID sick leave hours, but you could donate all other hours, again, vacation and sick leave. And we can certainly post additional information on the COVID-19 site.
Next question, will testing for employees be offered in other locations besides Redwood City? Redwood City is difficult to get to for some staff. Also, is testing only available for permanent employees? Is anything available for extra help and seasonal employees?
Yeah, I mean, I would certainly open it up to any employee, whether it's extra help, seasonal, or otherwise, part-time, or whatever it may be. I would open it up, and I'm hoping it's open to everyone, and it should be. Yeah, I mean, the problem is the cost and the numbers, right? So we're trying to put it where most of our employees are. And certainly, I know that this campus is not the most accessible to everyone who might be working in North County. But when Justin gets back from vacation, he's on vacation this week, taking a much needed week off. I'll talk to him about maybe seeing if we can be a little bit flexible and opening it up. If we have a center, and I don't know where you may be working, if we have a location in particular where we've got a lot of employees, and again, it's a numbers thing, that maybe we can move it there, not on a weekly basis, but maybe 1 or 2 days for every other week or something along those lines. So let me explore that a little bit more, because I do want to make sure everyone has an opportunity to avail themselves of this service.
Next question, for those of us that are coming into work physically now, will we be able to get hours of compensation, example, time and a half hours accrued during the shelter in place?
No, we're not looking at that right now. We are, still trying to manage a deficit budget here. And we understand that the sacrifice you're making, but we should have now for all of you in place. And that was really in the early stages of this pandemic because we were still trying to figure out, how to safeguard our employees with plexiglass and PPE. In a lot of cases, PPE wasn't even available at that period of time. So we're not considering that right now because of the budget constraints and the investment that we've made in employees in different ways. But I certainly understand your concern, and I want to make sure that you are covered and that those essential service workers who are here now are some of the first to get the vaccine. Rather than, someone who maybe is working remotely.
Next question, Mike. The county had a program to help landlords for those who may not have been able to pay their rent. Do you know when there will be a response for those who applied, and will there be additional assistance?
I think that there's federal assistance on the way to help with that in this new stimulus bill budget that they're bringing forward. And I don't know your particular circumstances. We really pumped a lot of money into that, and we will re-examine that in the new year to see what the needs are of those who live in this county, certainly. And we talked about potentially coming forward with more funding there, but we're also going to wait and see what comes through the state from the feds in that regard to see if there's money available in that package. So we'll keep you posted on that. Hopefully you've heard, and we're passing that through the nonprofits, our core agencies for that assistance. So I would check back, if you've not heard, I would check back to the core agency to see where your application might be.
Just a time check, Mike, it's 3:28 and we have a few more questions.
Yeah, let's
to
keep
go.
going.
Let's keep going. All right. Is there a reason why we as a county can't mandate testing, with exceptions, of course? And as a county, can't we prohibit county people from traveling irrespective of federal mandates? We can be a role model for others. This can help limit spread.
Yeah, it's really a fine balance, and we've really tried to balance people's civil liberties with healthy protocols throughout this. Certainly, we can't mandate someone to get tested. I think it's a great practice. I think it's important, but everyone's going to have to make healthy decisions based on their own circumstances. And though there's virtually stay-at-home orders in place, I don't know why anyone would be traveling right now unless there's an emergency or something along those lines. So those stay-at-home orders are in place in this region and really throughout the entire state. So I would hope that we would adhere to that and make sure that we did model that. I think that's extremely important that we do that. The testing is definitely a good thing to do, because there's so many people asymptomatic out there who are exposing others, their loved ones, and everyone else. It would just be nice to know if you had it or your loved ones have it, so that you can isolate and prevent yourself from spreading it, and certainly coming in and spreading it to others. But even if that is the case, and we adhere to all the safety protocols, the masks, the sanitizing efforts that we're doing, the plexiglass, all those things should help prevent. But it's going to be up to you to not get near anyone, even wearing a mask. Try to talk at a remote distance. And I always try to do it beyond 6 feet. So just to try to keep that in mind.
Next question is, how long will the expiration date of the EFMLA be extended if the board approves a proposal on January 5th?
I believe that's into February. Is that through February, Rosia? Is that correct?
That's correct, to February 23rd.
Right. So February 23rd, we're hoping that the federal government takes action beyond that.
Next question is, this person's had several family members and friends go through the COVID-19 testing site and they're losing tests. What is the county doing to fix the issue?
I've not heard that before about losing tests. That's, I know that and we'll look into that. That's the first I've heard of it. So thank you for bringing that to my attention. I mean, for example, for me, you know, I got tested on Tuesday and I didn't get my results till Saturday afternoon, late afternoon, with Curative right out here. But I can tell you that every lab is inundated with tests right now. I mean, we are seeing tests at astronomical numbers that labs just can't keep up. And that's so important, right? Because if you're positive, we want to know as soon as possible so we can get our contact tracers on you to try to warn you and your family know, and those who have been exposed to know. But if you do have an exposure, I'd actually like to stay home like I did and work remotely. It was, you know, something that was difficult in my case. I don't like doing it. I do like being here at the county. I think it's important for me to be at the county, but it was necessitated by the circumstances.
Next question is, can the COVID-19 sick leave be used for mental health appointments?
Rocio?
So the federal government has outlined various criteria for use of that leave, and unfortunately, I don't believe so. Appropriate leave would be things like quarantine, going to testing for symptoms, and also childcare due to closures. So I don't believe it would cover this, but certainly you can use other accrued leave.
Next question is, can we donate the emergency sick time to staff who use them for childcare?
No, unfortunately, but again, catastrophic, we do have catastrophic leave, so you could donate other hours.
Next question is, I do not want to get the vaccine for COVID. Will this vaccine be mandatory?
It won't be mandatory. It's an individual choice that everyone's going to have to make on their own, but it will not be mandatory.
Next question is, it would be beneficial if you could send a clarification of all of the leaves we as employees have. I was hired right before the pandemic, and given the unprecedented times we face, I didn't receive much information of what we have in general or what's available due to the pandemic.
I think that's a good suggestion. Rocio, can we send that out?
We can certainly send that out, and we do have some of that information available on the SharePoint site, but we will send out information, absolutely.
Yeah, maybe we can do like a one-page fact sheet on that. That would be terrific.
Perfect.
Next question is, the US EEOC has issued guidelines that allow employers to require employees to get COVID-19 vaccine and block them from returning if they refuse. Will the county issue guidelines soon regarding COVID-19 vaccinations?
Yeah, absolutely would do that, but I just can't imagine us mandating it.
Next question, does the county have plans for a COVID-19 vaccine clinic similar to the seasonal flu shot clinic?
I think we talked a little bit about that earlier. We just don't know. It's too early, but there will be mass vaccine sites. We know that, and I would not be surprised if, you know, like the event center it's doing testing was converted into one of those locations. Whether we'll be able to secure that for our essential service workers, I don't know yet. I'd love to see that, and certainly we'll push for that, but I don't know given the tier system that the state has set up.
Next question, will the forfeited vacation hours cap maximum 80 hours be extended to February as well instead of expiring on December 31st, 2020?
The lifting of the vacation cap will continue through the emergency.
Yes. The answer is yes, through the pandemic.
Next question, is there a grant that can be used for employees which are teleworking to provide an ergonomic work area such as a stand-up desk and chair?
Louise, I mean, Rocio, do you know if that grant, what that grant provides for in that regard as far as equipment?
So absolutely, it's a grant through the Office of Sustainability. And so departments submitted their requests and they've been offered various grants, and it does allow for telework, some telework equipment such as laptops. But I'd have to look specifically at that and to see what other items are covered, but there are resources available And then we also have a partnership with Office Depot where our employees are able to order supplies through there. And of course, departments have been provided the guidance that wherever possible, employees should be able to take home their chair, their, not their monitor, but their keyboard and other types of equipment that they may need.
Next question, will the maximum vacation comp time accruals be lifted for employees who are reaching their max and are unable to take time due to the stay-at-home order?
I believe that's a similar question to the one before, so yes.
That'll go through the pandemic.
Next question, is our health officer concerned with the new variant in the UK and visitors arriving through our international airport?
Yeah, let me just talk a little about that for a second. We are, and again, Ileana and our staff at HSA, I wouldn't say are inundated, but they're seeing a rise in the amount of people that are arriving here and are positive. We've instituted a new policy to try to dissuade this, that anyone arriving here that needs to be housed by us will pay for that housing. If they have to quarantine for 10 days, they will need to pay for that, plus an administrative fee for us taking care of them. And we are looking at, federal legislation that would require testing before you got on board, rather than you're able to fly here, get tested, you're stuck here now because you can't get back to where you are, and we cannot let you loose in society because you're positive. So it is a little bit of a mess right now, but we want to dissuade people from traveling and showing up here who are positive.
And the last two questions, Mike, why can't we require vaccinations before returning to work?
Really, it's a personal choice. It's a medical type of situation. We don't do it for. It's just. I think it's wrought with the whole legal challenges to that, and folks' ability to make a decision on their own, an informed decision whether they want a vaccine, whether any type of vaccine, what it is. We do know that when a large segment beyond 70% of the population gets vaccinated, this disease will die out eventually, like others have. So once you reach that herd immunity of vaccination, so not everyone does. So we hope, like I said, I can't wait till my number's called, but everyone else is going to have to make that individual choice.
And last question, Mike, with the increase in cases, what happens to employees that are being told by management to still go into the office even when we don't have to see clients and we're being asked to go into the office to do work we can do at home?
Yeah, and I would really talk to that manager or that director and, let them know that you could do that work at home just as effectively. I have certainly asked every director to decompress their work area as much as possible for the next 3 weeks while we look at this, while we're under these new stay-at-home orders. And I would expect them to fully do that and utilize this time to work in a different manner.
And we've got one last raised hand, Mike, from Lillian Clark. Lillian, I'm going to unmute you and please ask your question.
Lillian, how are you?
Doing good, Mike. How are you?
Good to hear your voice.
So I just want to just kind of say to everyone on this Zoom meeting that I have friends and family that live and work in other communities and counties. And I just want to say that I'm really proud of our leadership in this county, and I'm proud of my colleagues in this county, because I think we've all worked really well together to continue to provide existing services and new services to make our residents safe. And I just want to wish everyone a happy holiday season. Thanks everyone for all that we've done.
Happy holidays, Lillian. And I think that's such a great segue into closing this out. I couldn't have said it better. I'm just so proud of all of you and the way that we've all come together and worked. And certainly so proud of our Board of Supervisors and all that they have done and will continue to do. I just wish all of you a very, very happy holiday season. I know it'll be different for many of you, but please know that this is I believe, one of the last hills, if not the last hill we have to climb to finish this marathon. And we will finish it by sprinting across the finish line like we started this and like we have throughout this entire race against time. So thank you all. Please stay safe. Happy holidays. And thanks again for all you do.